Okay, very good morning to all the team members. Okay, hopefully we can see each other, everybody here. Hopefully everybody fine and healthy. Okay, God bless everyone. So today we are sharing about a topic on colorectal cancer based on the what is happening nowadays in Malaysia. Some of the data. So I gathered here in the slides coming on, and we see how bad is colorectal cancer that giving bad in every country. It's some kind of tragedy happening in all over the country in the world now. But Malaysia is one of the top cases of colorectal cancer. Why? It's due to certain problems. Okay. So let me share the screen. Okay. Okay, so we are today our topic is colorectal cancer and holistic approach. How we try to avoid this, how to prevent this colorectal cancer from our overall lives. At least we can save our children and our family members. Prevention is much better than the treatment. Okay. Can you see all? Everybody can see the the first slides?
Yes, Doc, very clear. Ken.
So today we're going to discuss about statistic of colorectal cancer, risk factors, incidence of the factors, staging, prognosis, and holistic approach. Okay, this is the statistic in Malaysia. We can see 13.2%. Okay, cancer among men and among highest lah. Actually, we can say it's quite highest in the cancer category. When you see disease is highest among the Chinese, followed by Malays and Indian. This is the statistic. Later, I try to explain why Chinese, Malays, and Indian, why this kind of things is figured out. So when we see the admitted cases on the colorectal cancers, based on the statistic, Chinese has highest issues on colorectal cancer, followed by Malays and Indians. Okay, mortality rate for males is 1.42 times, and compared to females, males have a higher mortality rate. Majority patient at the stage 3 and 4, while only 8.4% at stage 1. Because it's not easy to identify unless you have a bigger problem appeared in your body. Other than that, it's just like slow poison inside to keep on inside. A slow progress tumor or something like that. So if you see the conventional chemotherapy range is 13,000 to 27,000 based on different stages. Average 21,300 per patient. So this is the cost that you need to come out when you have colorectal cancer and you want to go for the chemo treatment. Okay, worst case scenario, we have no choice lah. Okay, if you see quick scan on cancer, at one time there's about 90,000 to 100,000 people living with cancer. Okay, 55% women and 45% men. Okay, this is the overall cancer. So 1/4 Malaysians will develop cancer by the time they reach age 75. About 10 smoker will be lung cancer, 1/3 cancer preventable. It's dependable. So if you see breast cancer, 14.5%, most common among Malaysian women with 4,000 new cases every year. Colorectal, 12.1%, cancer involving the colon, rectum, 3,000 new cases every year. 11.8%, the top killer in the world. Okay, with 2,100 new cases every year, lung cancer. And this is a Malaysian statistic. If I see cervical rising recently, 5.7, nasopharyngeal 5.4. This is information from the Cancer Society of Malaysia. So that's a statistic. And you can see Malaysian common symptom of the disease. Altered bowel habit 41%, blood in stool 35%, abdominal pain 31%, weight loss 31%, anemic is 9.8%, intestinal obstruction 9.3%. This is the percentage. Okay, so percentage of the common symptom of the disease. Okay, this is some of the things. So when they have this kind of problem, then they go and see the doctor and they go through. And actually, it's a almost same causes of the colorectal cancer. Major cause of risk factors: unhealthy Malaysian lifestyle. Okay, we eat too much food and too many hours with food. Okay, we don't stop eating. Okay, consumption of too much of red meat. You see, when you say red meat, I see Chinese community and Malay community, actually they are more to red meat. Indian community actually very low in eating red meat. That's why the colorectal cancer is very less in the Indian community. But if you see Chinese community, they're eating so much of red meat. And when they eat, they also consume too much of water. That is a negative points. Okay, negative points. While you're eating, you are taking water, means that your acid in the stomach will be diluted. So the meat cannot be break into pieces, a small chunk that can easily penetrate towards the small intestine. But when you put when you drink water too fast and eating too fast, and the meat is not break into pieces, it's stored in the stomach, end up with a lot of acidic consumption. Acidic will be absorbed and the meat will be break down into small pieces and no nutrition anymore already. Then end up the day, it travel towards your small intestine, end up all the acidic will end up staying at the rectum area. Until the next day you go toilet, the acid already accumulated in that area with the tools. So you are using too much of acid in the tools, in the ash, that food. So it stayed in that area. That's why when you see colorectal cancer always happen in the anus area, rectum area towards the sigmoid. Okay, toward the sigmoid area. So these are the major place on your left-hand side of your large intestine. So from the left-hand side, complete left, sigmoid plus rectum. Okay, these are the area especially highly damaged. Okay, highly damaged with the colorectal cancer. But when you see in the right-hand side, not much, because all the food is already pushed in towards the left. So end up it stay there too long. Okay, too long with too much of acidity. Okay, and we are eating too much of processed food. Okay, nowadays a lot of junks such as nuggets, this one burger, chicken, okay, burger, chicken, burger, this chicken, so many type of chicken, so many type of meat, then barbecue, then satay, so many things. It's all processed food. Okay, and less taking greens, low intake of fiber consider. Okay, and also I see consuming alcohol also damaging the stomach area, because alcohol can cause damages in in the stomach, small intestine, large intestine, liver, pancreas, and also spleen. Okay, and high smoking. So these are the major cause what is going on in the risk factors. Okay. So we see some incidents begin to increase significantly between the ages of 40 to 50. Why 40 to 50 is high rate? Because in this time, okay, in the 40 to 50, a lot of people already losing their teeth. Okay, so when you see 20 years to 30 years up to 40 years, you can see the teeth structure is still strong. But 40 towards 50, a lot of people are start to reducing calcium because they had lack of fiber, they lack of green fruits. That can cause in a long term of an imbalance of a calcium level in the body. This is one of the cause. They have a problem in their teeth structures and the teeth become damaged. Some people start to using a plastic teeth. Some they just use whatever teeth that they can go and fix Okay, so in this kind of scenario, and a lot of people have imbalance of eating. So when they eat, they cannot munch properly. They try to swallow food rather than the munch food because the teeth is not structurized. And 40 to 50, you see, even though the teeth, they don't use the what you call what you call clown, the fixing teeth, the fixing teeth. Okay, the fixing teeth actually is just to look clearly, but it's not very strong to bite your food. This can cause your food is not break into small chunks. Okay, 90% of the cases occurring after age 15. Okay, 50 to 60, some more become worse. Okay, some more become worse. Okay, so these are the problems that happening into the people's factors. That's why when you're getting older and older, you must make sure you are taking a lot of natural calcium, such as pearl powder, roselle, spirulina, GL, green veggies, fruits. Okay, this that has rich in a calcium base of natural foods. So when you have take a lot of natural classified food, then your structured teeth and your bone density will be higher. Then you have no problem in this kind of thing. And always make a habit of munch your food. Because most of the people I see, if you see Chinese families, some are worse. They are very fast eating. They're using a fork, and this one, they're using rice bowl. They just swallow the food very fast. Okay, so that is one of the cause that food is not digested. Then immediately they drink a lot of soups. So you don't digest the food properly. That's why we need to change accordingly. Then the system can work well. Okay. The history of radiation therapy prostate cancer associated with the increase of risk of rectal cancer. There's something, this is another database study. Some radiation therapy for guys, especially prostate cancer. When they have prostate, they will give a radiation. When they give radiation, that area, the rectal also become damaged. Okay, this is another cause of the colon damage. Okay, this some other studies, history of radiotherapy, same thing as I told you. Okay, consumption of omega-3 fatty acid, mainly as fish oil, black cumin. See, black cumin associated with a reduce of incidence of colorectal cancer and observational studies. Some studies is there based on the studies. That's why black cumin is very good for your colon. Okay, when you have like, you see, it's not a black cumin. It's omega-3 fatty acid. So whatever product or food or vegetables or fruits that contain omega-3 is very good. Virgin coconut oil is very good because all these things will help the movement of your colon, okay, and never store the tools more than 24 hours in your rectum area. Okay, that's why going toilet a daily basis 2 times minimum. 1 time is okay lah, but still not good. If we can go 2 times in a day, that is a very good ready. Okay, that's why you see born babies, they go 3 times. Okay, the engine is very fresh, so you can work out very well. So fish oil, black cumin, virgin coconut oil, spirulina, all these things can help you to balance the colon movements, and this can reduce the risk of colorectal cases. Okay. Okay. About staging. So this is a staging. This is on the cancer. Okay, the FTS, TIS, T1, T2, T3, T4. This is quite technical. So we move to the next stage. And the picture you can see there for N category colorectal cancer. Okay, so N category, NX category, NO, N1, N2. So N0 is a no lymph node involvement is found. If N1 cancer cell found with 1 to 3 nearby lymph nodes, then they put under N1. Okay, N2 is cancer more than 4 lymph nodes swollen, then they put N2. So this staging is the stage 1, stage 2. So they can say T1, N1 or T1, N0 or T2, N0. Okay, so these are the names that they're giving lah. Okay, so when they come out with this, that's why I say stage 1, stage 2, stage 3. This is how they're planning the staging based on the calculation. That's why I always say staging is based on the what do you call it? It's a rules. It's a rules that they already put. Okay, T1 mean the cancer has grown through the mucous mucosa, extend into the submucosa. If they put T2, the cancer has grown to submucosa, extend to the muscular problem, outer muscle layer. So this is the based on the biopsy, okay, and the doctor's observation on the current situation. Based on the observation, biopsy, and they can say, okay, your problem is in the stage 1, stage 2, stage 3. Okay, that's how they're staging it out. Okay, when you go next, then M category of colorectal cancer. So M category indicates whether cancer has spread to distance. That means metastasis, such as liver, lungs, or distance. So T1 and on or M category means it's already metastasis lah. M0 or M1, distance spread is present. So this is the code they use in a biopsy report or PET scan report, all these kind of things lah. Okay, so you see how they're staging it out. Stage 0, stage 1, stage 2, stage 3, stage 3, 4. So based on the size, based on the spread out, where it touch, how many nodes it touch, based on that, they will put the stage. So when they say stage 3, that means, okay, stage the tumor size like this, okay, you already touched 2 nodal points. So this is how they're staging it accordingly. Okay, so tumor markers, when you see expert panel tumor marker breast and colorectal cancer, okay, they will using CA 19.9. Okay, 19.9 can use as a breast or colorectal cancer. So it's like a very basic. So you can either use for this or that. That's why sometimes the cancer markers, tumor markers can give you a different kinds of a problem. So it's very hard to detect whether here or there. So that's why they do PET scan, and also sometimes they do ultrasound, whatever it is lah. So to find out where it goes and where it attacks lah. Okay, that means stage 1, T1, 2, and O. This is how the things going on. 5-year survival rate contemporary series of 119 patients treated 1991 2000 certified according. Okay, so the percentage of detection. Okay, when you say stage 1, a lot of people have stage 1 problem, but we can't see, we can't 90% is cannot, 93% cannot detect. Stage 2, stage 3, stage 4. So until certain stage, then only we can detect. The survival rate also very low. Okay, this actually survival rate in 5 years. So when you get when detect the colorectal cancer, when they say stage 1, your chances surviving is actually 93%. Okay, so but stage 2 treatment 85, it keep on going on. But even though they keep on giving you chemo, all these things, you can slow down it, but you cannot stop it unless they cut it down. But still the lymph node is connected, it's already spread to lymph node, it can come back again. That's why a lot of people, after the colon is operated, then it come back again, because some of the nodes is already affected, but you can't see in the PET scan or whatever, can't see. Some nodes very maybe mild, you can't see it much. Unless it's 6 months or 1 year time, then only that nodule can be find out. Okay, the colon stages of the colon cancer. Okay, this is how the stage is lah. Okay, these keep on growing bigger and bigger. So this is some of the colon tumors size. You see giant polyps, big polyps, you see predental polyps. So the polyps is joined again. So there's a ways left and right. Okay, if your colon is normal, it's like first picture, colonoscopy normal. The second one is pedunculated polyp, then flat polyp. There's so many type of polyp tumor is appeared. So it's depend on what type of polyp. When you do a colonoscopy, then we can see what kind of tumor and which the area is located has been affected. Then whether removal of that part is needed or not needed is dependable. Okay. Okay. When come to holistic approach, what is the best way to take a holistic approach? Okay. Micro veggie is a very good solution to make sure can take by anybody, even children from 3 years onward. You can mix it and give. 2 years onward, you can drink, start to drink juices or whatever. You can take small amount. You don't need to put 1 scoop, but you can keep a small amount, maybe half scoop, mix in his juices and ask him to drink. So this will help them to colon cleansing every day. You must remember when the colon is start to accumulate the junk inside the colon that cannot be removed from the body. It means from the toilet, never go out. So some of the junk stay inside. So your colon never clean out. It end up with a tumor, polyps, all these kind of things. That's why colon must be very clean and fiber must be eat very early days. So every children, like every 1 week, 2 times or 3 times, you mix the micro veggie, you give them. It easily help them to cleanse the colon in a daily basis and weekly basis. At least they don't have a junk stored in the area of the rectum, sigmoid, descending colon, sigmoid, and the rectum. So this area is clean. So chances to get any other tumor or any other polyps is very, very less. Okay, chances to attacked by the virus such as like this Crohn disease, all these things will be very, very mild. So microveggie playing a big role on this matter. Okay, why? Because microveggie consists of lot of fibers, celery, Texas mulberry, also all the celery, a lot of fibers. You see, a lot of fibers. So all the fiber, everything will help them to balance the things and also cleanse plus regenerate the colon system. Okay, and morinzan is a fermented noni botanical juice that help the enzymes. When you create an enzyme in the colon, your wireless layer will be more improved on absorptions. Okay, so that means your food will be properly digest and the nutrition absorbed into wireless layer towards the bloodstream. And also morinzyme is the main creator of a mucus layer in your colon area to protect the colon rather than damaged by your food that you eat. Okay, and the third one you can say lion's mane. Lion's mane is very good in a colon digestive tract problem. Duodenal ulcer, wireless imbalanced, colon acidic high, lion's mane is playing a big role on that. Okay, the fourth one is spirulina. It gives you essential and non-essential amino acid that highly absorbable. Okay, wide spectrum of micronutrient. Okay, it has beta-carotene, chlorophyll, all these things, and high in polysaccharide plus fiber. Okay, this is also help your colon, smooth colon. Okay, so worst case scenario when you cannot, when people will detect with colon problem, okay, you can approach them with the mycovita high level plus mycoveggie together. Mycovita and mycoveggie together mixed with morinzyme. So this is more powerful to cleanse a lot of area of that, to repair and cleanse back all the area of the colon area. Okay, so if you go through a mild polyps, make sure you start to take the product. Otherwise, the polyps, or you see, when it's very small, we can call it polyps. When it becomes bigger, it becomes a small tumor. Then it becomes bigger, it becomes big tumor. Okay, so it can be like that. It slowly grow. The big size is become a tumor. Then you need to remove the part of the colon. And spirulina cereal is the best fiber source of things. Fiber plus the spirulina make your colon more healthier. Okay, it's a very high fiber, and you can give a cordyceps coffee. Okay, and okay, very fast. Okay, cordyceps coffee. Then also you can see this the diaphragm of your colon system. It consists of a stomach, okay, and duodenal, then large intestine, lower intestine. So you make sure your colon is properly taken care. Okay. In 2012, colorectal cancer claim killed almost 700,000 men and women worldwide. It's a form of cancer that highly preventable with diet. See here, It's a form of cancer that can highly preventable with diet. What kind of diet? Proper food diet. So make sure you don't take too much of meat. Red meat is a killer for the colon. It cannot digest properly. Okay, but if you take, it doesn't matter, but make sure you munch as much as possible. Don't swallow your meat. Munch your meat, break down into pieces, then so it will make sure your colon can easily digest it. Remember always your colon don't have your small intestine, your large intestine, your stomach don't have teeth to munch. Okay, remember that. It only have acid hydrochloric that can damage the more when it used. Okay. So the last one is thank you and take care of your colon. It's very important. Everything start from your colon. Remember that. Everything start from your colon. If you can take care of your colon, okay, if you can take care of your colon properly, means that you are free from disease. Okay, you are free from the disease. And it also not from the colorectal cancer, it also from other type of cancer. And I mean, because toxin is accumulated from the colon area. If you eat clean food, your colon become clean. If you eat junk food, your colon become a rubbish bin. So you want your colon become a rubbish bin or become a real colon, is depend on you. Okay, it's depend on you. Okay, so go back to the Q&A. I already stopped the screen. Any Q&A questions for today part? Any questions today?
Doc,
Yes.
okay, based on the statistic that you have shown on the screen just now, it seems that breast cancer is the highest. Why?
Okay, if you see breast cancer is highest, you see currently we have so many reasons, okay, so many risk factors. The first thing, our food is no more food. We are taking too much of a red meat. Okay, we need to control taking a lot of red meat. Second, if you see ladies nowadays, they are what do you call their shirt, their bra type. Okay, in UK, the bra type is already changed, so they don't agree to use a wire type or the what do you call wire type or some kinds of string type. It's not good because it can block some of the blood circulatory system in the breast area. Okay, this is in a research paper they have written down. Okay, most of the breast cancer patients, when they do research, they are using a wire type that can reduce the blood circulation towards the lymph nodes, that area. Okay, second things, they're using a PVC type of things, so it shouldn't be. Better is the using of a cotton type. Those time all people are using a cotton type of bra type that is enhance the blood circulation because cotton is natural. But recently we can see a lot of people go fashion type that can damage the circulatory system that go through that area. So you're blocking the blood circulatory system and end up with the blood improvement is not good. Okay. Second thing, if you see utilization of the roll-on, your armpit, okay, the chemical armpit and the roll-on, what they call deodorant, okay, that also cause a lot of damages and imbalance water retain inside, because you must remember the deodorant is actually some kind of wax. Okay, in your armpit, actually your armpit is a breathable area. When you see breathable area, they are water, junk water. Sometimes you can see the armpit are wet. Why wet? Because this water is keep on releasing there. This one of the removal, water removal area. But when you go and plaster it with the deodorant wax, yes, I know it's you can feel the smell. Okay, sometimes you feel uneasy, uncomfortable, but that is a processing area. So when you go and block it, the water that's supposed to go out will stay inside. This also can lead to lymph nodes swollen with the water cyst. When you're getting long term, it can be damaged also. That's why I always say, if you want to use if you want to use deodorant, go and find the natural source. You go to internet, you can type in, you can use. I still remember some therapy that you can use virgin coconut oil, vinaigrette, virgin coconut oil, and I also don't know another one. There's a mixing. So when they're mixing, they put in the water, they just spray in the armpit. So this can release the smell. Okay, and we also have like a talcum powder, DXN talcum powder. You can use that also. You can use frequently because talcum powder consists of GL, so it's much better. So this is one of the things you can avoid. Third thing is your food. Lack of exercise. Okay, lack of exercise, lack of water removal, like your sweat. Okay, especially ladies, I see a lot of people very less of sweats. So sweating a lot with a lot of dirty water from the body is actually good blood circulatory system. You can improve the circulatory system in our body. It also can remove toxin from the body. So removal of toxin also very important to reduce the lymph nodes accumulated with the sweat water. Okay, that also can be toxicated. So if you see reason, there are so many type of reason. Taking fast food nowadays. Nowadays, people like to eat too much of fast food, especially processed fast food, potatoes, meat that processed so long. Okay, so these are the things. I don't say cannot eat, but must go as minimum as possible. Once in a blue moon, you are taking is okay. But when you take every day fast food, 1 week, 3 times, 4 times, you are increasing the junk. Okay, this is also you need to reduce. Okay, so if you take a lot of fresh vegetables, if you take a lot of fresh fruits, this will lead you to cleaner systems. Okay, in a longer run, your body become less toxicated, and these kinds of problem will be reduced as much as possible. Okay, Rita? Any other questions?
Okay, good. Thank you. I remember you said last time the company is trying to develop a new product for roll-on.
Yeah,
how is that
okay.
going on?
We already submit everything, but after the MCO 2 years, everything is stopped. Even come off factory also they have to stop. How to do the production? Maybe it comes but I'm not sure when. Maybe in the product list is in a process of what do you call process of production, but don't know when okay, because everything is a cost But if you want to do your own roll-on, you can go to the net, you can go and type Google, you can see how to make a natural deodorant. You just type that, natural deodorant. So there is a lot of ways that you can create your own roll-on. Okay, own roll-on. You can use shea butter mixed with this virgin coconut oil, mixed with some aromatherapy oil. Then you can create your own roll-on. Okay. Actually, you can use. It's not very tough. And natural solutions are very simple. You can get from the net. A lot of people giving that solutions. You can go and get it from the net. So you can create. So we have virgin coconut oil. You can mix it with this shea butter. Then you can use it Okay. Good. Okay. Any other questions? Okay, there's one question here. Doc, stage 1 of bladder cancer, a bladder tumor. Okay, every tumor is dangerous. Okay, every tumor is dangerous. Depend on how you are treating it accordingly. That's why combination therapy, like natural therapy mixed with the modern medication therapy, when you combine, we can get a better result. But with a single, we can't get a better result. With a holistic treatment, we can slow down the process. Sometimes we still need a modern medication to somebody to remove that portion and balance it back. That's why it's like combination therapy. But in Malaysia, very sad to say, they don't want this combination therapy. Otherwise, we can give the doctors very good idea what to do. Not like, oh, chemo 6 times, radiotherapy 6 times, remove all. That is a wrong judgment and wrong treatment has been given. In reality, when we combine, we can see a better result. Because I can see when they combine, or people who combine, we can see better result. Okay, and the survival rate is more than 5 years. In chemo, the survival rate is only 5 years. So they only maintain the patient with 5 years. They don't care after that. In 5 years, they can wall up whatever they can wall up. So they don't care after 5 years whether the patient is live or not. Their job is to maintain the patient in 5 years, but in deep shit condition. But with the combination therapy, we can sure the patient can live more than 10 years. More than that. And I have treated more than 10 years people are living. Okay, I got cases that more than 10 years already. I was 17 years in DXN. More than 10 years, lot of cancer patients survived with combination therapy. It's also depend on the doctor how they're playing the game. Okay, so that's why sometimes we are very sick. We cannot communicate with the doctor. They don't want to receive your idea. When we go there and we explain to them also, they don't care. Some doctors are good. Some doctors is not in the place that they want to listen to you. No. So these are the things dependable on the doctors. That's why we try to communicate with some doctors. Whoever can work out with us, we work with them together. Okay. Any other questions?
Doc, Pavisha raised her hand, Doc. Maybe Pavisha wants to share something.
Yes, Pavisha.
Yes, Dr. Siva. Okay, now I just want to have a small chat with you. Not colorectal cancer. Let's go a bit back. One of the symptoms, gastroesophageal reflux.
Okay.
I have a patient who's suffering very bad of it.
Carry on.
Okay. So what's happening now is that her sphincter muscle, which is in between our diaphragm, is actually inflamed. So what happens is that it's very often she has that reflux, and then when the inflammation happens, so diaphragm is constrict, she's having breathing difficulties. So for now, she's been taking 2-3 months consistent, exactly what you prescribed last, so micro-AG, morenzyme, lion's mane, and coconut oil. So my question is, I want to help her for immediate relief, because right now, whenever she calls me and said, "Hi, doctor, I'm having breathing difficulties, what can I do?" Immediately, I would just say, okay, popping 4-5 tablets of lion's mane, try to bring down the acid down, or quickly just take a morenzyme 20 ml neat to bring down the acidity. So is there anything else in your experience?
First thing you need to tell them, that's why I always emphasize certain things from the day one. First thing, she must maintain the food timing.
Yes, correct.
Breakfast 7 to 9 must take. Munch properly and take properly. Okay? Okay. Second thing, 12:30 to 1:30, make sure she take a lunch, sorry. 4 to 5, maybe a glass of coffee or whatever, small amount. 6:30 before 8 o'clock, take the dinner, finish.
Okay.
Before sleep, maybe they can just take half glass of just milk, pure milk. Just heat up the milk, hot milk, just hot milk, drink and sleep. Okay, why 11 o'clock, a small amount of milk? Because in the early morning, if 8 o'clock she eat, by 12 is 4 hours, by 4 o'clock in the morning, she will get hungry. Then the acid will go up. So if she take half glass of milk, this acid, it ultimately, the milk will already convert it into yogurt. So it's alkalinic in the body. So she
Understood.
won't
Thank you.
have a morning gastric. This is the first thing she need to do.
Okay.
Second thing, she must avoid certain oily food in the night, and also meat. Stop totally meat. Ask her to
Correct.
stop
Okay.
totally meat.
Mm.
Okay, she can go for fish and chicken.
2-3
white
weeks
meat
lah.
lah, not red meat.
Mm.
Red meat stop because a colon not
Okay.
in the place
Yep.
and not enough
Correct.
strength to digest red meat.
Correct.
Okay, so
Okay.
she must change a bit. So she must forgo a little bit until the colon come back to in a normal condition. Then she can take this bit. The third thing is spicy foods.
Yep.
And avoid durian, all this kind of food.
Okay.
Okay, these are the things, because you see durian can cause a lot of acidity in the stomach because your stomach unable to break it because it's like sticky. When it's too sticky, when you pump in into few durian inside, like 1 or 2 durian, the skin, the fruit, okay, it go and stuck in the stomach like a ball.
Oh, okay.
It cannot penetrate towards the duodenum, towards the pylorus gate. It cannot penetrate towards it, so it's stuck into the pylorus gate. It's like a what do you call rubber.
So
Okay, that's why it can cause a lot of acid.
to kind of emulsify it.
Correct. That's why durian, you can take 1 piece, 2 piece, it's okay. But when you take a lot, this is not good for people. Okay. So she have to change on that and make sure she munch her food and use the saliva as much as possible. Don't drink water while she taking food.
Correct.
Okay, ask her to change. Once she change, follow the things accordingly, and slowly she can see the difference. If you don't, if you see every time when she call you, sure she miss her food, then she call you. Huh?
Yeah,
So
yeah,
you ask
definitely.
her what time
Because
she is at the
she's
last.
she's a restaurant owner, secret recipe owner here in Senawang. So I know. When I tell her, when she called me, I said, "You had your lunch?" And no, lah, doctor, I didn't have
Then
the time.
how?
I said, so I told her the day you start changing your lifestyle, that's the day you're gonna see result. If not, you go on having this type of lifestyle lah. Every 2-3
She
days
never
you
change. I tell
she's
you, God come
trying,
down,
but
give you
quite
medicine
stubborn.
also, she won't recover because she never
Exactly.
change. Okay, so
Okay.
she need to change a little bit. You see, holistic medicine really works, but you also need to change.
Yeah, definitely.
Okay, if you don't
Correct.
change,
You
you
need to work
only
together
depend
with
on,
holistic
I
lah.
want taking this, I will live on. No, you
Correct.
must change.
Correct.
So depend on the problems. That's why we are here to guide you what to do, what to do, to bring you into the correct part again. So
Correct.
once you come back to the correct part, you follow the correct part, you go back to the normal condition already.
Correct.
I've treated so many thousands, I think, from my experience of this kind of thing. Every time come and sit down crying. My gastric pain 3 years never stop. Go and take. They buying like Gaviscon, like
so far? 6
bundle
months
by
sitting with
bundle.
you in so many cases we saw already.
Bundle. You know, people buy Gaviscon like bundle by bundle. They keep.
Yeah.
Taking too much of gastric medicine, Gaviscon, all these kind of things, it will end up with colon cancer.
Yeah, correct. Just create a gap in the whole.
It's already it's proof that even FDA already say.
Yeah.
And then all this gastric medicine is put under the surveillance, under the black box warning.
Correct.
Black box warning is a surveillance under the FDA. But you know lah, the doctors can prescribe you like nobody business, like a kacang putih, they can sell you something.
Yeah, like Candyland like that only lah.
So that's why you see combination of our medication with the changing of their attitudes, everything will play a good role.
Yeah, it's a perfect combo.
Yes.
Okay lah. So then,
Okay.
at least I know I'm doing the right thing, and now it's all up to her lah. She needs to put
Yeah.
her foot down and change her lifestyle lah. All right. Thank you.
Okay. Come, anybody? Any other questions?
Good evening, Dr. Siva.
Yeah, good morning.
Good evening. Doctor, I'm calling from Penang. Generally, what de-action products would you recommend for prostate BPH condition?
Okay, for prostate, okay, you need to, first things, you need to take codipine, vinaigrette, okay, codipine, vinaigrette, richelieu powder.
Richelieu powder.
Okay, mix all these things and drink Morinzi, sorry, Morinzi, the last one.
Morinzi.
Okay, Morinzi.
Please,
Mix like 10 ml, everything. and 1 scoop of Ricilium with Codipine 10 ml, vinaigrette 10 ml, Morinzi 10 ml with Ricilium 1 scoop. Mix and drink 2 times or 3 times. Okay. Then you have to take bee pollen.
Bee pollen,
5 tablets munch 3 times daily.
5 tablets.
Then slowly you can see the things are getting better. Okay, even though your CA marker 700, 800 also will come down. Don't worry. I've treated a lot. Treated a lot. Too many patients already treated. Prostate is very easy to treat with holistic. I already treated all my cases success. Okay, prostate, no need to worry. Very fast we can see. Because prostate is actually not a cancer, it's actually only enlargement. But their hospital, they always say it's a cancer, it's a cancer, it's a cancer. It's not a cancer. It's an enlargement. Okay, it's an enlargement. It's not a cancer. It's an enlargement. So with our treatment, you can go back to the normal condition. Yeah, very fast one. Okay, I got so many testimonials.
Means nothing much to worry about the PSA reading, doctor.
PSA reading will come down. You just keep on taking. After 3 months or 6 months, you see PSA reading will come down to normal.
Okay, please, doctor, because I'm not very familiar. I'm just I've been introduced to this DXN product just recently. So can you repeat that product earlier?
Codipine.
Codipine.
Vinaigrette. Morinzi. Morinzi and Ricilium powder.
Psyllium powder.
Ricilium powder. Ricilium powder. Then bee pollen.
Bee pollen. So bee pollen we got to munch.
5 tablets munch and eat 3 times daily.
3 times. The others all mix together and drink, is it?
Yeah, in a glass of warm water, just shake and drink.
How many ml, doctor? Each
10 ml. The water base is 10 ml. The powder is 1 scoop.
10 ml.
10 ml each and powder 1 scoop. Shake in a glass of warm water, shake and drink. You can go for 2 times or 3 times, no matter.
Okay. Thank you, doctor.
Okay, thank you. Hello? Any other questions? All quiet, ready, everybody?
Doctor, there's another question. Just another member of family, this eye problem, what they call it, glaucoma.
Okay, glaucoma actually is actually blood vessels already damaged inside. Okay. Okay, blood vessel damage. Normally they give you some steroid things. Glaucoma cannot be reversed. Remember, it's already damaged. Why it damaged? Because this patient, you see, if the person lack of sleep every time, okay, when they have a lack of sleep, utilize their eyes too much, very high stress person. This kind of people always have glaucoma because the blood vessel behind the eye is already breaking. Okay, what you can give a Hong tea capsules, Hong tea GL, Hong tea GL, spirulina.
Spirulina.
And bee pollen.
And
Gano oil, you give 1 drop in the eye. 1 week, Gano oil, 1 week 3 times lah. 1 week 3 times you give a drops in the eye. Before sleep lah, night sleep. Before sleep you put Gano oil 1 drop. Then slowly the blood vessels, the damages, the pressure in the behind eye will be reduced lah. The eye pressure will reduce.
The first one, GL, something GL.
GL. GL, you can give 1 capsule 3 times.
Okay.
This Hong tea capsule. Hong tea capsule 3 times daily. Then spirulina, maybe you can give 5 tablets 2 times daily.
Okay.
And bee pollen. Then
Bee
Gano
pollen,
oil, put 1 drops 3 times in a week lah. Night before sleep.
Oh, okay.
Yeah.
Okay. Thank you so much, doctor.
Okay,
Thank you
okay,
so much.
okay, good. Okay, guys.
Next question, Rita. No question. Arin Roof mana? Tidak ada plan ya? Also clever, the doc.
Yeah, every time listening. This one, today one, I will upload to the system later.
Actually, eating on time is
very, very important.
very, very good, doc.
Very, very important.
I've done it for 4 months now. It improves the digestive system, sleeping pattern, everything improves. You have a question now online, I think, doc? No.
Okay, let me see. Kalau ada batu ke empedu, apa kita perlu buat suplemen apa? Okay, just now the codipine vinaigrette richelium is also enough ready. Okay, this 4 item is very good ready for the empedu. I save back in. For empedu, same thing. Codipine, vinaigrette, richelium, moringa, you mix and drink. And also you must take a virgin coconut oil for empedu. Okay, virgin coconut oil, 2 tablespoons 2 times. Two times daily. For the empedu, that's very important. Okay, I already write down here. Okay.
Doc, maybe later, maybe.
Yes, Selena.
Doc, maybe later you can talk about the new product which you posted, the betel leaf, is it, or something like that?
Oh, okay. Wild betel. Okay, betel leaf is very straightforward. Okay, if you see, betel is long time used by so many countries lah. Until now, the export also very high. Okay, it's very good. You see, betel is always have like mint type of cases. Sometimes when you have a sore throat also, you can take some portion of the betel you can munch. Okay, it also can clean your mouth bacteria. Okay, can create a better smell. Some people have a very bad smell in the mouth. You can give the wild betel to them because the wild betel consists of virgin coconut oil, betel, and also honey. So it's like a chewable sweet. Okay, it's very good for people who have a bad breathing. Okay, and also if you don't have bad breathing, you also can take. You will have a very good throat. Okay, if you have a throat infection, throat throat itchiness, the betel is very good. If you have gum bleeding, okay, gum bleeding, any teeth problem, all these things, you munch the betel is very good. Okay, and also it's also betel is also very good for the stomach upset. Sometimes you can feel like bloated stomach, so you can take 1 or 2 tablets of the betel. You can munch it. See, remember, betel is very good. If you munch it, don't swallow it. If you munch it, it's very, very good. So munch it and eat. Then you can see the real properties using with our amylase. So betel work well with amylase. So don't miss that. Don't go and swallow that. Like you put spirulina, you swallow. Like you put RG gel, you swallow. Don't do that. Make sure you munch it and absorb the taste using your saliva. Then it work well. Okay, in this situation, COVID, you can bring this betel together with you, because in any moment you can feel your throat is something like itchiness or whatever. in that kind of scenario, make sure you take the betel, you put in your mouth. It's a very good in this season. Okay, Dr. Lim is very good. He come out right place, right time, in this place, in this time. So you can buy and always keep your hand, and you can every time put in your mouth. Nothing to be worried. So it's very safe. It's very natural. It's very organic. Okay. So it can give you a best mouth smell. The mouth almost not no more smell. You can your mouth more perfume give a natural perfume to your mouth. Okay, and also it will protect your throat, lungs. Okay, it can cleanse off the bacteria in the throat and lungs area. Okay, so it's better to take it and use it as much as possible in this scenario in current COVID scenario. Is very helpful. Give it to your children, whoever. If you want to go market also, you just put 1 or 2 in your mouth, just chew it and go to a market or buy anything That's a safe side Okay, clear?
What's the taste like, doctor?
The taste like a betel taste with little bit of honey taste, because they already put the honey there. So you won't feel like a real betel. You see, when you pluck out the betel, you put in your mouth, you feel the taste like something like a very high mint, like that. When you put total high mint, you feel like that. But this one, when they mix with BCO and that, you feel like very like tubal type you can chew it actually. It's very hard to tell other than you try yourself Okay. I don't know Sabah Sarawak got
not available in Sarawak yet. It's not available in Sarawak yet.
Yeah, later will come
Okay.
Okay. So take it and eat, then you know. And I advise you, this is the right time. You can keep it in your pocket every time, wherever you go, because COVID is keep on attacking everywhere. So better you just put in like a chocolate like a chocolate and eat Okay. Good. So the information, the total information I shared in a group, you can go through and read every part and partial that I shared to you all. Okay. Oh, very quiet already at the group. Hello?
Okay, thank you, Doc.
Good.
Rita, your mother, I think is taking betel leaf.
Oh yes, they're taking the together with the nuts.
You remember one thing, the old timer who take betel leaf, their teeth are very strong, you know. Okay, their teeth are very strong. Okay, people that never take like old people, you see, they always munch the betel. You can see, even though they're 70 years, they still have their teeth, you know. Okay, the problem in a betel mixing is only the kapur the kapo is not good, but other than that, it's okay. It's actually natural nutrition one. Okay.
Yeah, the betel nut is also quite good. That's what I heard
You see Bangladesh, Pakistan, all very famous. India, Bangladesh, Pakistan, all I tell you, everywhere you can buy. So among any weddings, all the Indian weddings, everything, they're using this one. In India, very famous Even I see one WhatsApp shows the betel with all these things they put inside. They put oil, then they put fire in it. No, then they push it and put in the mouth. You know, with the fire itself. Wow. In India, they're doing that. Wow, my God. I don't know how's that taste. If I go India, maybe I try. Fire betel leaf.
I heard from my colleague the betel nuts because I used to see them munching the betel nuts in the office. So I was asking, and they say, "Hey, this is very good, you know. It's something like, it works like Tongkat Ali." That's what they were saying.
Not like Tongkat
I
Ali,
don't know how
no
true
lah.
that is.
But it's really good for you carry on. Actually, this betel, wild betel is a good things that you can hand carry to anywhere you go. It's like a peppermint sweet. You just keep it like a peppermint sweet lah. So you try it, then you know lah. It's very nice. Okay. Good. So if no other questions, we can end up the session today. It's already 9:13 today. Let me